Hi, Peggy Kraus for Erasing Diabetes. If you are fearful of taking insulin injections to lower your blood glucose someday, then you need to listen because I'm going to give you an alternative. So, insulin should be the last resort for lowering blood glucose. We use oral medications first, and then if those aren't working, we use insulin. Sometimes if you go or admitted to the hospital will use insulin to lower blood glucose, or if your numbers are very high, insulin is what's going to work the best. But let's just talk about type 2 diabetes, not type 1, because with type 1 diabetes, insulin is a lifesaver. But in type 2 diabetes, it's much different. So if your blood sugar if your blood glucose is high, right, the doctor finds it to be high, your doctor in the past would have given you 3 months to clean up your lifestyle, fix your diet, add some exercise, bring those numbers down naturally. If after 3 months your blood test showed that your blood glucose was still high, the doctor would give you metformin. That is our first line drug for diabetes, type 2 diabetes. If after a few months those numbers were not in range, the doctor would either adjust the levels or maybe give you a second oral medication. We would use sulfonylureas like glyburide and glipizide in addition to metformin. If still those numbers were not in range, then the doctor would give you a third medication. And there was a bunch of different medications to choose from. And because the different medications work in different ways, using several of them together could really help to lower the blood glucose, because you might not respond to one mechanism of action, one drug, but you might respond to another one. And that's why using a combination really works. There has been the newest class of oral diabetes medication. Those are the SGLT2 inhibitors, and they have been shown recently to have some cardiac benefits. So many doctors are going right to those. But even though they have some benefit in the lab, I have to say that I'm a little suspicious over what's going to happen long term. So the reason why insulin is a problem for me and for you with type 2 diabetes, because insulin is a growth hormone. It's a mover. It moves carbohydrates into the cells to be used for energy. It moves proteins, amino acids. It moves fat into fat stores so that people, when they start on insulin, they gain weight. Not only do they gain weight, but their levels of intracellular lipids increase. Now, we've talked about this before. What happens when your intracellular lipids increase? Your blood glucose numbers increase as well. And if your blood glucose numbers are high, what's your doctor going to do? Going to give you more insulin. Take more insulin, gain more weight, more intracellular lipid, more. Do you see the cycle? It's hard to break. The only way to break the cycle is to stay off insulin. So if you need to take 3 oral medications, I've seen patients on 4 oral medications. So those are my choice, but then again, all medication has dangerous side effects. So the best way to clear out intracellular lipid is with diet and exercise, right? A high fiber, low fat diet with exercise is going to clear out that intracellular lipid, right? And when the intracellular lipid goes down, so do your blood glucose numbers. If your blood glucose numbers are low, if they're in range, you don't need even oral medications. So what I have done for you, at the bottom of this video, click the link. The link will take you to my 5 diet tips to permanently lower your blood glucose. With these tips, you can bring your numbers back into range. Yeah, you'll lose weight, your intracellular lipids will decrease, all good things will happen. There are no bad side effects when you're eating a healthy diet. So go ahead, click the link at the bottom of this video.